प्लांट साइड पे रखो तो आप थोड़ा रहो असिस्ट करो. Now let me know where exactly the point is located. LU-5. Now I am talking about the transporting points, commanding points, communicating points from one organ to other organs. But so far we studied without bothering to any other organs. I told you to one specific organ you wanted to treat without bothering to any other organs. Now we are talking about something is connecting to the internal organs, get shifting of the energy to be taken place. That means energy get interchanges. Those points to be known as a, yes, that is the command points. That is the energy shifting point, polarity shifting points. The first point to be known as a Chiza. The first point to be known as a Chiza according to the meridian. But the first point of the meridian to be known as a, that is Shaoshang, that is LU-11. That is LU-11, the energy starts, then it goes to the spring. From the spring it goes to the stream. From the stream it goes to the river. From the river it goes to the sea. That is the pathway. When the Chipo and then Huangdi on the Yellow Emperor Classic of the Internal Medicine, they were doing the conversation. Sir, where the energy starts? So that time they were telling the energy starts from the well. Energy starts from the well. Where, for example, in our home is there, in that home we require the water. So that water we cannot go to the river and get the water. We cannot go to the stream and get the water. We cannot go to this ocean or the sea to get the water. But we do require the water from the ground level where we can easily take the water, catch the water. So that water to be known as a well water to drink and to take the shower and day-to-day uses of the water. So that water to be known as a well water. Then if it is the greater level people wanted to use, more than one family, that one single family well water is enough, or one particular area of the people wanted to use the water, that time spring water is required. Where the canals are there, where we can take the more water. Then there is a more larger of the 2 to 3 areas or the villages people wanted to use the water, they required the stream water. When the one state to other state the people are required to use the water, then river water is required. When we do require the country to country people utilize that water to be known as a sea water. So this point to be known as a well point, the second point to be known as a spring point, third point to be known as a stream point, fourth point to be known as a river point, and fifth point to be known as a sea point. But in fact this point is the beginning point of the meridian, but at the same time this point to be known as a last point of the lung meridian. Because this is a uniting point, which I told you, well, spring, stream, river and sea, that means is a uniting together. You know Atlantic Ocean, right? Then Arabian Ocean. So many countries will going to join and make it as a junction that's communicating, that to be known as a Ha Sea. Ha means H-E, Ha, pronunciation. That means is the sea in Chinese. That point to be known as a sea points. So hopefully you understand. Now let me see that Ha-C point is, where is it located. Now I'll tell you the anatomical location. That location to be known as a on the cubital crease. On the, once you semiflux, first you need to do the semiflux. After the semiflux of the hand, right, then you can find the tendon. All of you please try. Whenever you will get the opportunity, try to correct it when I am teaching you. Later period, you may forget where exactly. You try to correct it and then if possible show me this the point is correct or not. You will get appropriately answer right now, because before leaving this class, at least 11 points in your mind. But 11 points you can treat the number of the diseases, not one disease. In that case, you will take this message to your home, then implement in your clinical practice. Now we understand the first point to be known as that is the chisa, that is LU-5. You touch and feel the tendon, you will get the tendon to be known as a bicep tendon. So how the tendon is developed? You remember these muscles. This is the biceps muscle. There are the bi means is the two. There are the two muscles to be known as the bicep muscles. You come down, these bicep muscles will become one tendon. The tendon to be known as a bicep tendon. Right? You touch and feel the bicep tendon. So bicep tendon, medial side and lateral side. There are the two divisions. So this is as a thumb side is the lateral side, pinky finger to be known as a medial side. This to be known as a medial side, this to be known as a lateral side. So now in between these two, lateral side of the tendon, not immediately lateral side of the tendon. Remember, this is the key. Where the point is located is slightly lateral to the, slightly lateral, not immediately lateral. So that means this point is lateral to, slightly lateral to the bicep tendon in the depression. This muscles called as a brachialis muscles. This muscles to be known as a biceps muscles, but Tianfu and then Xiabai points are located on the distal to the deltoid muscle, lateral to the bicep muscles, but these muscles to be known as a brachialis muscles, where LU-5 point is located. One shown? Yes. Yes, you can. Yes. So now you remember this is the bicep tendon. From the bicep tendon on the lateral side, you touch and feel now. You touch and feel, and then slightly lateral to this particular point to be known as a chisa. This point to be known as a chisa. That is LU-5. This point to be known as a chisa LU-5. So now you can have a look. This particular point is, you can do it as a 1 chun, maximum 1.5 chun. You can penetrate this point. Make sure there is a vein is there. That vein to be known as a, that artery to be known as a cephalous vein. That cephalic vein that shouldn't puncture it, but please be seated. If you wanted to use it, or you wanted to puncture it, but certainly you can use the puncture on that particular point as well. When the lungs related problem, you wanted to treat as a sedative point. This point to be known as a sedative point of the lung meridian. Sir, what does it mean exactly, sedative point? You all know there is a mother point. The other one is the sedative point. The mother point is nourishing. Nourishing means is providing. Providing means is giving. Giving means are strengthening. Strengthening means stabilizing to that particular organ to be known as a mother point. But this point to be known as a sedative point, that means opposite to the mother point. Already the lungs energy is existing in the lungs. More energy is existing, that I wanted to deplete the energy, decrease the energy, reduce the energy, deplete the energy. That time you just sedate. But once you do the sedation, but this will get the sedation of the energy, anti-direction of the energy flow activated. This indirectly will be helpful to treat for the two organ. One organ to be known as a lungs, the second organ to be known as a kidneys. You are treating two organs. One organ is, this is the which point? This is the water point. That means is the water point is draining point of the lungs, which passing the energy to the kidney system. So therefore LU5 is equivalent to the K7. LU5 K7. So either you can use the K7 point or you can use the LU5 point. Both the functions are same. Both the physiology is same. Now sir, how we can recognize which point we should use it? Through the pulse diagnosis you will come to know, so which organ having the deficiency, which organ having the excessiveness. So if you understand, yes, sputum is there, more in the lungs. Sputum is more in the lungs. The cough also more. That indicating anything excessive retention or accumulation in the lungs which causes this problem. Then time you just deplete the energy. You decrease the energy. Once you decrease the energy, that means you are depleting this lungs energy. That dispel the mucous membrane. That goes the energy to the downwards direction, and then kidneys are receiving the energy to doing the water metabolism and also purification and cleansing of the water and mucus. Then that detoxify through the renal system. So therefore LU5 you can use it as a one point sedation. Either there is the allergy related disorders, when the skin related disorders, eczema, psoriasis or anything connected to that, we wanted to do that, drain out the energy by using the point to be known as a Chiza, that is LU5. So where exactly the we try to find out, yes, we try to find out the cubital vein. So this is the lancet I am using. You just open this lancet and then I am inserting this on the cephalic vein. So yes, now I am just puncturing on the blue color veins. Just I am puncturing to the blue color veins. Sorry, let it come. So this we are puncturing to the cephalic vein, which is unwanted blood. You can find out this is not required. This not required, this blood. So this is toxicity of the blood. You just wipe it. Now this blood to be known as a toxicity of the blood or the morbid accumulation. So you are draining out of the lungs energy as well. You are draining out of the lungs energy. Your vicinity of that area, around that area, you wanted to detoxify, you can detoxify. You can detoxify the blood. When you wanted to use this blood, that venous blood you wanted to withdraw with the syringe by using the hypodermic needle, then this blood to be inserted on the Huantio, that is on the gluteal muscles, on GB30 area as well. But however, that procedure, only medical doctors is advisable to do that procedures. But here, better you can bleed, so that can be possible. Kindly you just do it whether there is anything allergy related disorders or the skin related disorders or the lungs excessive function is there, phlegm is more retention, and also there is a hand pain is there, arthritis is there, shoulder pain is there. Certainly for the shoulder pain is the very good point to be known as a Chiza, that is LU5. All the lungs related problem, as I told you, as the activation LU1, but however this point also, excess energy can be depleted by using the single point. Having the hundreds of the diseases can be treatable by using the single point. Such a beautiful, all the kidney related disorders, acute kidney related problems and the major lungs related problem, both can be segregated to the normal by using this one particular point. So hopefully, which time is advisable to use this specific point? What are the organ clock time of the lungs? 3 to 5 AM. Good. But what time you need to deplete the energy? 4:30. You can deplete the energy. However, 3 to 4. 4 a.m. having the peak energy, right? The opposite time is 4 p.m. 4 p.m. having the less energy. But when you wanted to withdraw the amount of the energy, 4 a.m. would be better time to withdraw the amount of the energy by using the LU-5. The best time to apply the LU-5 point is at 4 o'clock in the morning. Sir, if it is not possible, then what can be done? Then try to find out what are the kidney timings. So what are the kidney timings of the organ clock? Very good. 5 to 7. 6 o'clock is peak time. 6 o'clock is peak time. Evening 6 o'clock. But already evening 6 o'clock having the ample of energy. Then when energy is required? Morning 6 a.m. is required. 4 a.m. is not possible. Then you have the alternate time to be known as a 6 a.m. You can use it this point. Either you can use LU-5 or K7. Any one point you can use it, or both the points can be advisable to use it, both the points at a time. Either it is the morning 4 o'clock or in the morning 6 a.m. is advisable. Yes or no? Sir, both the time may not be possible. What should be done? Whenever patient comes to you, that time you just apply the needle that have the efficacy level. But you wanted to get appropriate results. Your diagnosis is good, but the treatment you wanted to do it on time. Then you can do it, because the organ clock theory is not the theory of you and me, and not only acupuncture. It is a universal law. It says that. But however, this is the proven that organ clock theory, every 2 hours, each and every organ is predominantly functioning in our body system.